Have you ever heard of uterine fibroids? These are non-cancerous growths that develop in or around the uterus. While some women don't even realize they have them, others experience heavy periods, pelvic pain, bloating, and even fertility issues. The good news? Medications can help manage fibroid symptoms, reducing pain, shrinking fibroids, or even preventing them from growing larger. If you or someone you know is struggling with fibroids, understanding the available treatments is essential. While surgery is an option, many women prefer less invasive approaches first. In this video, we'll break down the top 10 medications for treating fibroids, how they work, and what to expect. Number 1. Gonadotropin-releasing hormone, GnRH, agonists. One of the most effective medications for shrinking fibroids is GnRH agonists, such as Leuprolide, Lupron. These drugs temporarily put the body into a menopausal state, stopping estrogen production, the hormone responsible for fibroid growth. When estrogen levels drop, fibroids shrink and symptoms like heavy bleeding improve. However, since these medications mimic menopause, they can also cause side effects like hot flashes, night sweats, and mood swings. GnRH agonists are often used before fibroid surgery to make the procedure easier by reducing fibroid size. However, they are not a long-term solution because fibroids can regrow once treatment stops. Number 2. GnRH antagonists, relugolix, elagolix. Similar to GnRH agonists, these newer medications work by blocking estrogen production, but they do so in a way that reduces menopausal-like side effects. Drugs like relugolix and elagolix help shrink fibroids and reduce heavy bleeding, often with fewer side effects than traditional GnRH agonists. These medications are sometimes combined with add-back therapy, which includes a low dose of estrogen to help counteract bone loss and other menopause-like symptoms. They are a great option for women who want a non-surgical way to manage fibroids, but don't want severe hormonal side effects. Number 3. Birth control pills. If your main issue with fibroids is heavy bleeding, birth control pills can help regulate your cycle. These include combination pills, estrogen and progestin, or progestin-only options like the mini pill. While birth control doesn't shrink fibroids, it helps stabilize hormone levels, which can make periods lighter and less painful. Birth control is a great option for women who also need contraception, but it may not be the best solution if fibroids are large or causing severe symptoms. Some women may also experience side effects like mood changes, nausea, or slight weight gain. Number 4. Progestin IUD, Mirena Kylina. For women looking for a long-term solution for heavy bleeding, a progestin-releasing intrauterine device, IUD, like Mirena or Kylina can be a good option. This small device sits inside the uterus and slowly releases hormones to thin the uterine lining, making periods lighter. While the progestin IUD does not shrink fibroids, it significantly reduces heavy bleeding and can provide relief for 5 to 7 years. Since the hormones stay mostly in the uterus, it has fewer systemic side effects compared to birth control pills. However, it may not be suitable for women whose fibroids distort the uterine cavity, making IUD insertion difficult or ineffective. Number 5. Tranexamic acid, Lystata. If you want a non-hormonal way to control heavy bleeding, tranexamic acid might be the answer. This medication helps blood clot more effectively, reducing menstrual flow without affecting hormones. It's taken only during the menstrual cycle, making it a convenient option for women who don't want to take daily medication. Tranexamic acid is particularly useful for women who cannot use hormonal treatments due to health concerns like blood clots or hormonal sensitivities. However, it doesn't address fibroid growth or pain, so it's usually used in combination with other treatments. We made a book, 10 Questions Everyone Should Ask Their Pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. Non-steroidal anti-inflammatory drugs, NSAIDs. For many women, fibroids cause painful cramps and discomfort, especially during menstruation. NSAIDs like ibuprofen, Advil, and naproxen, Aleve, help reduce inflammation and ease period pain. These over-the-counter medications are affordable and widely available, making them an easy option for short-term pain relief. While they don't shrink fibroids or reduce heavy bleeding significantly, they can provide temporary relief from menstrual discomfort. However, long-term use may cause stomach irritation, so they should be taken with food or as directed by a doctor. Number 7. Selective progesterone receptor modulators, SPRMs. Some newer medications like ulipristal acetate, fibrostal Esmia, work by blocking progesterone receptors, which helps shrink fibroids and reduce bleeding. This treatment is particularly effective for women who aren't ready for surgery but need relief from severe symptoms. While SPRMs show promise, they are not widely available in all countries due to potential safety concerns. Some women taking these medications require liver function monitoring, so they should only be used under the guidance of a healthcare provider. Number 8. Aromatase inhibitors. Aromatase inhibitors, such as letrozole, Femara, work by reducing estrogen production, slowing fibroid growth. They are more commonly used in breast cancer treatment, but have shown effectiveness in some cases of fibroids. These medications can shrink fibroids, but they also come with side effects like joint pain, hot flashes, and bone loss. Because of these risks, they are usually prescribed only in special cases where other treatments aren't effective. Number 9. Danazol. Danazol is a synthetic male hormone androgen that lowers estrogen levels, helping to shrink fibroids. However, it is not commonly used today because it causes significant side effects, including unwanted hair growth, acne, weight gain, and voice deepening. While danazol can be effective, it's often considered a last resort due to its masculinizing side effects. Most doctors prefer newer medications that achieve similar results with fewer risks. Number 10. Vitamin D supplements. While not a medication, some research suggests that low vitamin D levels may be linked to fibroid growth. Studies show that vitamin D may help slow fibroid development, making it a simple and natural way to support uterine health. Vitamin D is not a standalone treatment, but can be combined with other therapies. It's a good option for women looking for preventative measures, especially those at high risk of fibroid growth. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications, and cheers to a healthy life.